I would like the world to know that twice a year cleanings is just not enough for the average population. You should make sure that you are seeing a hygienist such as myself that's making sure that the periodontal evaluation is done thoroughly and properly, measuring the gums and looking at the x-rays, and making sure that you're brushing and flossing minimum 4 to 5 times a day. We have to make sure that we're breaking up all of that bacteria throughout the day. This way we don't have that precedence of the periodontal disease that most patients have, right? Making sure that you're having testing, that we're able to check to see the type of microorganisms that you have in the mouth that are underneath the gums, which are the anaerobic bacteria, which have you for higher incidence for other types of different cancers and different type of diseases that can oftentimes be unseen, but we're able to detect them just as simple swab with your floss. And we'll be able to let you know what you actually have, not just what's in the mouth, but all connected to your body.
And then when they start taking measurements, like brushing, flossing 5 times a day, and changing their diet and sleeping and eating well, you can retest them every 3 months, every 6 months, and see a change in those numbers.
And decrease, following our protocols, of course.
Awesome. Doctor, so what do you think people should know? You have traveled the world. You live in Qatar for 5 years.
He's doing the really, really hard cases of these cancers of the mouth, what are scary.
Yeah, where I will tell the people to don't be afraid to get treatment done because some people is scared about post-op and going to feel any pain there after. So some people won't get committed with the treatment because they feel that they would be a painful post-op. And I can tell you that nowadays we have a lot of technology. We have a lot of tools that we are using in order for the healing process to be faster, to be
Easy.
pain than before. So don't be afraid to look for help.
That's a good one. And we have sedation. We do laser dentistry. And obviously, if a patient is medically compromised, let's go over that. Because we have told some patients, it's not going to hurt, but then we find out they are medically compromised. We have somebody young that doesn't heal. There's something wrong with the medical history of that person. We have people with cancer that take longer to heal, and they're like thinking they're doing good. But we know when we see the blood that the blood is showing that the factors of growth are not good. That is, so sedation, plasma-rich growth factor, ozone. Thank you so much, Doc. You do a great job.
I think that's a really profound word that he used to fear, because I do hear that with a lot of my patients, is they're too afraid to go look and they're too afraid to do it. And I'm like, well, so was I. But when you fix it, you're so much happier and you stay on top of it. And by having the fear and not going forward to fix it, it's just going to get way worse.
Right.
Much more pain, much more destruction, and much more loss of the teeth, and a lot more cost involved if you're not fixing it earlier. And for me, I am completely passionate about what you put in the mouth. You need to put clean water and clean organic food without the pesticides, and try the best you can. You don't have to be perfect, but the best you can of getting your protein from hemp hearts. I have my hemp hearts every day, 8 tablespoons. That's 27 grams of protein, and it has all the amino acids that the human body needs. And then, of course, I'm always having beans and lentils. I'm making a soup every 2 or 3 days. It has beans and lentils in there and all my healthy nuts. So it's so easy to get your without having to eat always the animal meat. And if you think about how hard we try to keep our mouth clean, have you ever seen a cow's mouth or a chicken's mouth or a pig's mouth? And, their teeth are never clean and they're all rotted, and their poor feet are in feces and urine, and they have mold and fungus all over their feet. They're never bathed. Like, we're bathing every single day. And then you're taking their meat and cooking it for maybe, 15 or 30 minutes. You're not killing virus and so many of the pathogens. And they're not even drinking filtered water. They're drinking dirty pond water or out of a rusted bucket. And then their meat has a lot of heavy metal contaminant in it. So what you put here is the best thing, is to try to keep that clean and making sure you're getting your protein every day. But you don't have to do that getting it just from the animal meat. That's just that's not what the Blue Zone is talking about.
Thank you so much. You guys are awesome. Now everybody's vegetarian. Thank you, Debbie.